It was supposed to be a typical night in the ER, or so the staff thought, until about halfway through the shift, a father came running into the ER with his daughter, who was shot in the side of the face by her estranged boyfriend. His daughter was immediately placed on a gurney and rushed to the trauma OR to undergo extensive surgery. Shortly thereafter, the estranged boyfriend showed up in the ER, wielding his gun, screaming, "Where is she? She needs to die for breaking up with me." That immediately set off a code silver, which meant someone with a gun. The hospital went on immediate lockdown and all patients and employees to take safe cover. The alleged gunman ran through the ER, then into the hospital lobby, where 2 police officers were already called and present, given the hospital security staff were only armed with pepper spray and a set of handcuffs. The boyfriend was met with police presence and, realizing his situation, turned his gun on himself. He was pronounced dead shortly thereafter. Thankfully, the young girl made it through the surgery and will recover from her injuries. Yet it's doubtful she will recover emotionally for quite some time. The employees and other patients of the hospital were not harmed in any way during this incident. Note, this hospital had a workplace violence program in place and all employees trained in how to handle workplace violence, so they knew what to do. This, unfortunately, is not always the case. What is workplace violence? According to the Occupational and Safety Health Administration, OSHA, workplace violence is any act or threat of verbal or physical violence, harassment, intimidation, or other threatening, disruptive behavior that occurs at the worksite. Workplace violence can range from threats of verbal abuse to physical assaults or even homicide. According to the Bureau of Labor Statistics, BLS, 70% of all workplace violence incidents involve healthcare and social services workers. In 2014, 80% of nurses reported being involved in a workplace violence incident. In order to address workplace violence, you first need to do a risk assessment of your office. This means looking at your physical security measures, internal measures, and staff training. Physical measures are engineering controls or physical changes to the workplace that either remove a hazard or create a barrier between workers and the hazard. Examples of physical measures would include changing floor plans to make exits more accessible for staff, improving lighting in remote areas or outdoor spaces for better visibility, installing metal detectors, surveillance cameras, or panic buttons, controlling access to certain areas with locked doors, and replacing furniture with heavier or fixed alternatives that cannot be easily used as weapons. Internal measures are changes to the way staff perform their jobs to reduce the likelihood of violent incidents and protect staff, patients, and visitors should a violent incident occur. Internal measures are appropriate when engineering controls are not feasible or not completely protective. Examples of internal measures would include assessing and periodically reassessing patients for regard to their potential for violent behavior. This includes assessing work, financial, psychological, social, and physical factors, as well as factors that increase risk, including anger, trauma, history of violence, arrests, substance abuse, and financial instability. Staff training needs to include ways staff can recognize signs of anxiety and de-escalate patients at the earliest possible time to prevent potential volatile individuals from acting out. Training programs are most effective when they are designed specifically for a facility's particular risk profile. Examples of staff training would include providing frequent opportunities to practice skills learned and demonstrate competency. Common training objectives include increased confidence among workers in de-escalating aggressive behavior and managing aggressive behavior once it occurs. Staff recognition of escalating behavior, warning signs, or situations that may lead to verbal or physical assaults. Additionally, a standard response action plan for violent situations would include the availability of assistance, response to alarm systems, communication procedures, and self-defense techniques when appropriate. Protecting healthcare workers from workplace violence needs to be a top priority throughout the healthcare industry. For more information and resources on workplace violence, please visit the OSHA.gov website.